Hi everyone, my name is Marion Bradley and I am the president of Are You Dense Advocacy, which is the government relations affiliate of the breast cancer nonprofit Are You Dense. And with me here today is Dr. Beth Sieling, who is the newest board member of Are You Dense. Dr. Sieling is a board certified surgeon with Trinity Health New England, and she has been in the breast surgery, breast health field, how many years?
17 years here.
17 years. Mm-hmm. Her office is at the Breast and Oncology Center here in Southbury, Connecticut. So, first of all, congratulations, Dr. Sieling, on being our newest board member for Are You Dense.
Honored.
We're very happy to have you. And what we wanted to do first is explain what dense breast tissue is. So, Dr. Beth has...
We have a nice picture here that shows us density. Women who have non-dense or fatty breasts would be A. These are women that have a density rating of up to 25% dense, meaning that the white tissue you see here is glandular tissue that's dense. This woman also obviously has glandular tissue, but it's not dense. That's why it looks gray as opposed to white. But cancers would show up as a white structure. So you can see that a fatty breast, up to 25% dense, you would be able to see something much easier than in the category B breast, which is moderately dense, that's 25 to 50% dense, which then goes to the next level, which is a level C, which is 50 to 75% dense. And when you go to level D, that's over 75% dense. So you can see here that there's a very big difference between how dense each breast is. And we also have some real-time imaging. So we actually have some real images here of patients. We don't have their names exposed, but I have an example of each of the density. So this is category A, or fatty breast, or very low density, up to 25% dense. This woman, this is a MLO view, which means medial to lateral oblique, so that's how the picture is taken. And you'll see here there's a lot of vessels showing up. This is her breast tissue. All of this is breast tissue, and her cancer is very small and very obvious in this picture. If this little tiny cancer was identified in a dense breast, it would not be seen, I don't believe. So let's move on to the next category. This is category B.
So category B happens to be myself. That's why my name is here. In 2014, I was diagnosed with breast cancer, invasive ductal carcinoma. And Beth, what are we looking at?
So this is category B. So she's a 25 to 50% density, because you can see there's a little bit more added white areas compared to this picture. Marion's cancer was very easily seen by the trained eye because there's a spiculated density. A lot of women would say, well, what's that, and what's that, and what's that, and what's that, and what's that? That's all her breast tissue that's dense. But this little structure back here shows a spiculation, and that's a foreign body. That is not foreign body, but that is a cancer developing in a breast. And it was picked up very early again in Marion because she does not have extreme dense breasts. It was very obvious to see that as well. Moving on to the next category would be category C. These women have dense breast tissue, 50 to 75% dense, and this woman's cancer was not seen on her mammogram. Her breast cancer was somewhere in this region, and you don't see it because, again, it's a little white structure in there, and we don't see it well. This woman happened to have a screening ultrasound, and it did pick up her irregular mass on ultrasound examination. I performed her biopsy, and she also had a breast cancer that was not visualized on this picture. And then this category D image, again, even more dense than the last picture, very dense, greater than 75% dense. And interestingly, the only reason we knew this woman's cancer was present after looking at the mammogram was because she had a strange area of calcium in the breast. And we do look for clustered calcifications as well. And I thank goodness for calcifications at times because, again, this woman's mass was not seen. She had a mass in her breast. However, her calcifications were picked up, and this is what was biopsied. Interestingly, again, this woman had a mass identified with ultrasound examination, but it was not seen on the mammogram. The calcifications correlated with that ultrasound finding. So this just kind of demonstrates the different density in a real picture of a real patient and how we were able to biopsy them and get a diagnosis. But you can see how difficult it is to see if anything's in this breast here or even in this breast here, category C and category D.
So part of our Are You Dense logo is exposing the best kept secret. Are You Dense was founded in 2008 by Nancy and Joe Cappello due to Nancy's late stage breast cancer diagnosis in 2004. She learned something then no one was talking about, at least to the patient. So Dr. Beth, if you want to talk about that.
Nancy had this breast. Nancy had category D. She had an extraordinarily dense breast. She went for her mammogram. She was told everything looked normal, which it did on the mammogram, but there was a large cancer in her breast that was missed. So her density obscured the visualization of her cancer, and after being told she had a normal mammogram, shortly thereafter she felt something and was diagnosed with a stage 3C cancer, which is quite advanced. So she was upset, understandably so. So what was being done about the density? Nothing at that point. And along comes Nancy Cappello, who changed everything and changed paradigm shift. It was a huge paradigm shift in breast care when Nancy came and exposed the fact that nobody knew about this. And how do we get the word out that women with dense breast tissue should know their tissue is dense, their physicians should know they're dense, and they should have some other type of screening on top of their mammogram to help identify cancers. And this is what her mission was, and this is where we are today.
Clearly, the limitations of mammography are shown here, and the importance of secondary screening by ultrasound or MRI are clear here. So I think that's all the time we have for today. Thank you, Dr. Sieling, for being with us, and
Yes,
thank you all
thank
for
you.
viewing. Please know your density, and until next time, take care.